Thank you, and good morning, everybody. I'm Frank Loy, and the chair of this roundtable, and I want to welcome all of you to this session, which I think is going to be quite informative. I want to, first of all, before we do anything else, thank the planning committee that put together this program. It consists of Dennis Devlin, Richard Fensky, Lynn Goldman, William Halpern, Andrew McGuire, Al McArtland, Susan Santos, Kimberly Thigpen-Tart, Patricia Verdun, and Hal Zenik. And I think if you look at the program as you have, you will see that it is really a particularly thoughtful, constructed program, both in terms of the flow of the discussion and in terms of the selection of the presenters and the moderators. So I want to thank that group for putting this together. In the last X years, science has moved forward considerably in the area of toxics and chemicals. We know a lot more today than we did 10 and 20 years ago. And I think one of the questions that we want to discuss today is whether the regulatory scheme that relates to these chemicals and addresses the health impact, whether that has kept up with our scientific progress. Now we do, of course, have different kinds of chemicals. So we have those that are intended and designed to be biologically active. And I think those are in many ways regulated relatively satisfactorily. You'll tell me if I'm wrong on that. I'm sure you will. But, you know, when you deal with drugs and pesticides, that's one thing. When you deal with chemicals that are not intended to be consumed, are not intended to be biologically active, they have an effect, but do. That's a different regulatory scheme, a different scientific problem. And that is in large part one that we're going to focus on in the next 2 days. So I thank you all for taking the time to be here. Everybody in this room is constructive, plays a constructive role at your institutions. You have a lot of other things you could be doing right now. I'm glad that you chose to be here, and we hope to make it worth your time and your attention. Now, without anything more, we ought to go to the panelists of our session one. And let me just introduce them very briefly. The first is Lynn Goldman, a public health physician, trained as a pediatrician and as an epidemiologist, and now the distinguished, that's my term, not the university's term, the distinguished dean of the George Washington University School of Public Health. And she is nominally the vice chair of this body, but anybody who's worked with her knows that she's really the top boss. I say that with full admiration and gratitude. She was at one time the assistant administrator of EPA for toxic substances, and is a vice chair of the Institute of Medicine's Roundtable right here today. The second panelist is William Halpern, who is the chair and professor of the Department of Preventive Medicine and Community Health at the New Jersey Medical School and a professor at Rutgers University School of Public Health. And he serves on the board of environmental studies and toxicology at the National Academy of Sciences. And the third panelist is Nsedu Oba Witherspoon, the Executive Director of the Children's Environmental Health Network, and she serves on the Children's Health Protection Advisory Committee for the Environmental Protection Agency, and is a member of this roundtable. So without further ado, let me turn the meeting over to the panelists of session one, and let's have 2 wonderful days of thoughtful discussion.